Hello again. So I want to talk about vitamin C and PTSD. Not complex PTSD. I mean, that is one piece of it. Let's be honest. Vitamin C might be one of the most important micronutrients if you have PTSD. The reason being, number one, vitamin C is called for in hundreds of pathways in the body, biochemically speaking, and it just so happens that those pathways that demand vitamin C as a cofactor or as some kind of piece of the puzzle, those happen to be some of the same pathways, many of them, that you need to run a lot more often if you're dealing with PTSD, especially on a long-term chronic basis. So, we get that landscape of those two parallel pathways or overlapping pathways. Let me give you a few of what those pathways are. Number one, collagen synthesis. So collagen is a form of connective tissue that you have to repair on a regular basis. So bone, cartilage, skin, all of the above involve collagen and collagen formation. Well, in order to do what's called cross-hatching of collagen, you need vitamin C to do that. When you're repairing blood vessels, the blood vessels themselves are smooth muscle, but smooth muscle is encased in these sheaths of connective tissue that involve collagen. Thus, vitamin C is necessary. When we're talking about PTSD, you will note, because you've paid close attention to this channel, that the sequelae of PTSD, many of the sequelae involve the blood vessels and involve problems that go wrong with the blood vessels. We could make the argument that coronary artery disease, of course, heart disease itself, myocardial infarction, is typically about the blood vessels on the heart. Strokes, typically about the blood vessels in the brain. Coronary artery disease, arterial disease in general, CAD, typically some of those blood vessels coming right into the aorta, the abdominal aorta, etc. Diabetes, type 2. Okay, yeah, it's a blood sugar thing, it's an insulin thing, but honestly, the sequelae from type 2 diabetes is CAD, coronary artery disease. We worry because of the effects on the circulation. That leads to neuropathies, that leads to problems with the kidneys, that leads to problems with the eyes, that leads to problems with the brain. All of the above are the result of problems with the blood vessels, not bringing the blood to a lot of those end organs because of the diabetes. So again, similar scenario. Okay, so collagen formation. That's a vitamin C thing. But let's also look at the other things in the pathway. Let's look at the fact that, okay, in PTSD, what are you going to be needing a lot of in terms of neurotransmitters? Well, for 200, we have the neurotransmitter of norepinephrine, right? You're going to convert dopamine into norepinephrine. But to do that, you're going to need vitamin C. To convert the glucocorticoids in that pathway, cortisol, you need vitamin C. In fact, the adrenals in general, as we all know, right? Adrenal fatigue, PTSD, this is something that another sequelae of PTSD where we get issues with the adrenals getting so tired from all the freaking work they have to do with PTSD. In that scenario, the adrenals, well, not just in that scenario, in general, the adrenals slurp up 50 times the amount of vitamin C than the rest of your organs. Okay. Stress. Yes. So if there's a stress micronutrient, it might be vitamin C. Additionally, a lot of our detox pathways going through the liver in terms of detoxing or drug metabolism, meaning you're breaking down drugs, alcohol, breaking all those things down, vitamin C. Antioxidant vitamin C, right? In fact, that's probably part of the picture, really, to flesh it out further. Vitamin C is an antioxidant. It is one of those things that functions a bit like the bouncer at the nightclub, right? It's 12 o'clock and there's a guy who's drunk too much. He's inflicting a little cellular damage, right? You have the bouncer who's going to make sure he doesn't harm the rest of the people at the club. So he sort of takes him out, knocks him down, or make sure he doesn't harm anybody, right? That's vitamin C. Vitamin C is your bouncer, your cell bouncer. What else? Well, macrophages, those would be your white blood cells that are going to chew up suspicious things in your body, pathogens. They, in order to do that, they often like to have, bleach. This is not some kind of cloaked allusion to Donald Trump's well-received advice of ingesting bleach with COVID. Okay, I'm not even going to go there. But literally, you do have inside your cells, very small amounts, inside vacuoles, some of your white blood cells have bleach, the equivalent of bleach, right? Because of this, those same white blood cells don't want to be damaged themselves in the process, right? That was the thing that was not mentioned in the very crazy comment coming from the White House. So, yes, you have vitamin C around to change the scenario to be an antioxidant ready to help the cell in case it gets damaged from its own process of trying to take out the pathogen. Could be collateral damage. So that's another piece. Carnitin synthesis. What else? We got so many things that vitamin C is involved in. Many of them are pathways, like I said, that you're going to run a fair amount, given that you've got chronic trauma that you're trying to deal with. So consume more vitamin C, right? And the reason I say consume is, unlike the rest of the mammalian kingdom, who really, most mammals can produce vitamin C. They can create it. And they do so often they change the level that they're creating in the liver manufacturing based on the level of stress. So if you have moderate levels of stress, a rat will produce 15 grams of their equivalent, meaning if you calculate their weight, approximately 15 grams, in states of moderate stress. I think the typical level is somewhere around 10 grams. I'm guessing the FDA recommendation of 60 to 95 grams. Potentially that's insufficient. We're talking 15 grams versus 60 milligrams. Right, which even that number, most Americans are not hitting based on the standard American diet, aka SAD diet. It would be good if we could hit 60 in this country, but we're not. That's, like I said, due to the SAD diet, potentially due to increased need for vitamin C. That's another factor that is decreasing our stores. We don't really store vitamin C in the body other than in the adrenals. You have to use it and consume it, and under stress you will absorb more. But yeah, we lost this mechanism, this ability to create vitamin C. And so if we look to the animal kingdom, we should probably gauge how much C we need a little closer to how they increase their intake of vitamin C. If you want to talk about the apes, right? Gorillas, somewhere in the neighborhood of 4.5 to 5 grams a day a gorilla will ingest. That's pretty good vitamin C intake. So that's the main thing I wanted to say. Vitamin C, really important. Cardiovascular sequelae, I actually want to go back to that. Linus Pauling argued years ago that vitamin C, a deficiency of vitamin C, might actually be at the heart or root of the trigger, the cause of cardiovascular coronary artery disease. We've always thought, it's something with cholesterol because we watch cholesterol go up, but cholesterol might just be the effect. A deficiency, especially a chronic, not to the point of scurvy, right? To prevent scurvy, you basically need like 5 milligrams of vitamin C a day. Hopefully Americans are hitting that level. Not so sure, but hopefully, you can prevent scurvy. But 5 grams, not 5 milligrams prevents scurvy. 5 grams, that's what the gorillas are getting. So it might be, it makes sense, this idea that vitamin C deficiency could be more strongly correlated with coronary artery disease. Certainly, if you look at the people who consume the most vitamin C per their diet, meaning those that are plant-based, in case you were wondering, a plant-based diet actually has demonstrated in research consistently over and over again since the 50s that you reverse or have very little cardiovascular disease, period. In fact, you look at Esselstyn, Dr. Caldwell Esselstyn, who basically took on patients with severe coronary artery disease. These are people who had multiple stents. They had been told they had months to live, some of them, or a year, less than a year to live, and that there was nothing that could be done. They'd done all the surgical procedures that were possible, and essentially, I want to say he was at Cleveland Clinic. They tossed their arms up and went, we can't do anything else for you. So we got this guy over here, Esselstyn, who says he might be able to help you out, so go see him. So they were sending him all their last-ditch cases, and he put them all on a plant-based diet. And lo and behold, reversed their coronary artery disease, reversing heart disease. Many of the patients that were in this study, and this was in the 90s, are still alive. They were told they were going to die in less than a year, many of them. And you look at the research, they're still alive. If they've stuck with the plant-based diet, very few, it's less than 0.6, so 0.6%. In terms of the incidence, I think there was one person who had an event. The rest of them, no events. What's that about? Reversing serious heart disease? Completely? A large swath of patients? Why is this not out there? Anyways, yeah. Vitamin C, likely a player in that whole scenario, of course, and all the antioxidants rich in the diet, getting plenty of really amazing nutrients, fiber, right? You're going to clear more cholesterol. Again, and I meant to say this. I don't think I did. Cholesterol is cleared through the liver. One of the things you need to clear it, vitamin C. Fixing the lumen wall, right? Vitamin C. So many. And then you look too at some of the cardiac markers, for example, lipoprotein little a. And this is a damage control kind of molecule. right? It's a lipid that shows up when you've got damage to the arteries. It turns out it's probably second string to vitamin C. That could be the real story. It shows up, and it's possible that you've got a vitamin C deficiency, and so you're not able to plug the holes like you need to. So it's you bring in the second string. It's like having the Napoleon Dynamite as your bouncer. Is he really going to be able to stop the drunk guy? Maybe. Maybe. Anyways, that's it. Vitamin C, PTSD. You should be consuming it, and really, you should be considering going to a plant-based diet. In terms, I mean, in closing, I'll give you this story really fast. This was a patient with PTSD in their 70s when they came to me. I did the naturopathic stuff I do, really helped this person, anxiety, PTSD, depression, all these, mental, emotional symptoms, much better. And I was probably treating this person for like a year, and they come in finally, and she goes, my osteoarthritis is so incredibly painful. Hard to get up. The pain, I can't even like close my hands. It was, this kind of thing, hurt. Pretty intense pain. And this patient has fairly high pain threshold. Swelling, joint, everything hurt. Fatigue, low energy. And so I said, well, are you sure you want to hear what I have to say? I'm going to tell you something you don't want to hear. Okay. She looks at me. Okay. I said, I know you love meat. And she does. She loves meat. I said, do you think we can do something kind of revolutionary? Going to do 30 days, a month, where you're going to cut out the stuff. You're going to cut meat. You're going to cut dairy. You're going to cut sugar. Sugar is going to be hard because it's in ketchup. You got high fructose corn syrup. And like I said, you can refer to it 100 different ways on a label. It's going to be hard to get that out of your diet. You're going to go whole food, plant-based. Beans, whole grains, etc. Can you just give me a month? That's it. I think she wanted to strangle me, but she didn't. She didn't strangle me. All right. I'll try it, right? I can do it. So I get the call 30 days later, a month later. She was almost crying. Maybe she was crying. She felt like her life had been absolutely revolutionized. Could not believe the changes. No pain in her joints. And she thought this was old age. This is just old age. I hurt. The swelling was gone. Didn't have difficulty moving her hands. Energy was better. Fatigue was better. She dropped weight. And she's walking around and people are looking at her going, you look different. Why? You've lost weight. You're not puffy. And she said, I can't believe how good I feel. I thought this was all due to old age. She said, I did what you said. I cut meat. I cut dairy. I'm eating plants. Lots and lots of plants. And I'm not eating sugar. And she couldn't believe it. And this is the kind of thing where you think, oh, well, is it really going to make that much difference? Dramatic. Hundreds of cases like that. You can go down the list. You cut the junk. You eat plants. You eat a whole plant-based diet. In a matter of weeks, things start to turn around, even on labs. Vitamin C, PTSD. Thanks for tuning in. Audio.